Hi, Louwrens Swart here from Cape Town. Friends call me Blackie. I'm a maxillofacial surgeon in private practice. To keep our office SARS-CoV-2 free, we have made physical changes and adapted our standard operating protocol. For the first part, all areas of the practice have been classified by risk factor. Red for the surgery, yellow and orange for reception, and green for the staff restroom. All decor that could potentially harbor the virus, such as paintings and accessories, has been removed. Only hard and easily sanitized surfaces remain. It makes for a very minimalistic effect. All high-touch surfaces, such as keyboards and credit card machines, are covered with a plastic film that is replaced or cleansed after each use. We changed our patient intake to allow only one person at any given time, unless a companion, such as a parent or caregiver, is absolutely necessary. Reception and office areas have also become part of the surgery sanitizing process, with deep cleaning between all cases. We advise all patients to arrive alone for their appointment. During the appointment reminder phone call, triage questions are completed on the day of their appointment. Patients are asked to phone or text their arrival. When the practice is ready, they are invited in. We have a hand sanitizing station at the front door, as well as coverings for the patient's hair and feet. In South Africa, face masks are mandatory. Our goal is to make patients feel safe, comfortable, and confident in the sterilization and sanitization of the practice. It's all about keeping our patients happy whilst keeping the virus out. Patients are escorted to the treating area promptly, where medical history and clinical notes are taken, with staff and patients wearing masks. Social distancing is always observed to prevent viral spread by speech or coughing. In fact, we suspect this is a greater threat than an aerosol generating procedure. We begin each interaction by having the patient do a double pre-rinse with hydrogen peroxide 1% solution for 30 seconds. The patient is then seated, reclined and draped, and then only the mask is removed for commencement of surgery. Change time between patients has substantially increased to allow for extended sterilization and sanitization. We strive to keep all admin tasks within the practice to a minimum and complete them digitally as much as possible. All personnel now wear fluid-resistant scrubs, which are donned before they enter the office and doffed when they leave. The doffing area is outside the office, as this could be a potential risk area for fomites. I am responsible for cleaning the scrubs, and all staff members receive a fresh pair daily. Like our patients, we wear masks at all times. The type of mask depends on the activity, ranging from cloth masks for admin to surgical masks or respirators for clinical procedures. Deep cleaning is standard after occupancy of a room by any non-staff member. All staff members have been fully educated on the proper PPE use with particular attention paid to donning and doffing. Social distancing, especially during breaks and meals, is strictly observed and time without masks is minimized as much as possible.